So basically in this session, we're going to be talking about standardized cognitive assessments, more so those screening tools that are often used to screen for mild cognitive impairment or dementia. So the key word there is screening. So they're not really detailed enough to formally diagnose dementia, and they're more like an indicator only that there might be some sort of cognitive impairment present. And then we do further investigations either through functional tasks or through referring for more detailed cognitive assessments, depending on what information it is that we need to know. So why do we use them? What is the actual helpful information that we're trying to get from these tools then? The results of those assessments can actually assist us to label or name some of the changes in somebody's cognition, which is helpful for planning our treatment approach, but also sometimes it's helpful to educate family members or other members of the multidisciplinary team about what cognitive impairments may be present. So they may just see someone as a little bit confused, but if we do one of these screening tools, we can actually label it down to they're having difficulties with paying attention or difficulties with short-term memory. So we'll use them across a range of different settings. So from inpatient hospital settings to outpatient clinics, community OTs will use them as well. Although probably the ones that we're going to talk about today, you'll probably see most often used in an aged care setting, but you will also see them in other caseloads such as neurosciences and other medical specialties as well. So what are the most common tools? In this session, I'm going to run you through my top 7 that I've come across in my clinical work that I've done. And we'll talk about why they're good to use and why they're not so good to use in different circumstances, what the cutoff scores are, whether you need any training or not to be able to use it. And I've even put together a handy little cheat sheet for you that's got all that information in one place. So we're going to be talking about the mini mental or the MMSE, the MoCA, the ACE3, RUDAS, FAB, KICKR, and IQ code short form. So lots of abbreviations there. And if you've never heard of any of them, don't worry, by the end, hopefully you'll have a bit of an idea of what they're all about anyway. So in this session, I've built in some case studies, so that'll help you decide which ones to choose in different circumstances. And we'll also discuss some general tips, such as how to prepare to actually administer one of these assessments, what materials you might need, what sort of practice you might need to do yourself so you can actually give the instructions clearly. And I'll also run through some key points for when you've done it, how you actually document it in progress notes. And just because I'm super kind, I've even put together an example for you that you can have a look at. Then, as always, we'll have a wrap-up section. I'll give you some extra links where you can do a bit more practice at using some of these tools as well, particularly if you've got a helper that you can practice with. So as always, lots of content to get through, so let's dive right in.